What is typhus? Typhus is a disease caused by Rickettsia or Orientia bacteria. You can get it from infected mites, fleas, or lice. Modern hygiene has mostly stopped typhus, but it can still happen in places where basic sanitation is bad or if it gets passed on by an infected animal. Typhus comes in 3 main varieties, each caused by different bacteria and transmitted by distinct vectors. Murine typhus is transmitted by fleas that bite infected animals, primarily rats. Most cases in the US. It can occur in California, Hawaii, and Texas. Epidemic typhus, a rare form, is spread by infected body lice and typically occurs in extremely crowded living conditions. There is also a rare variant of epidemic typhus that can be spread by infected flying squirrels. Scrub typhus, on the other hand, is spread by infected chiggers or mites and is predominantly found in rural areas of Southeast Asia, China, Japan, India, and Northern Australia. While all 3 types of typhus can cause serious illness, they are easily treatable with antibiotics. Therefore, it is crucial to seek immediate medical attention if you suspect you have been exposed to any form of typhus. How typhus is spread. Typhus is spread through insects and other parasites. Murine and epidemic typhus are transmitted when infected insects, such as fleas or body lice, bite you and leave bacteria-laden feces on your skin. If you scratch the bite, the infected feces can enter the open wound or other cuts, allowing the bacteria to enter your bloodstream. Scrub typhus is spread differently. It occurs when an infected mite bites you, transmitting the bacteria directly through the bite. What are the symptoms of typhus? Symptoms of typhus usually appear about 10 days to 2 weeks after the bacteria enter your body. Initially, you may experience chills, fever, headache, and muscle aches similar to the flu, followed by a rash a few days later. Each type of typhus can have additional symptoms. With murine typhus, you might also have coughing, loss of appetite, nausea, stomach pain, and vomiting. Epidemic typhus can cause confusion, coughing, rapid breathing, nausea, and vomiting. Scrub typhus may lead to confusion or other mental impairments, a dark scab at the site of the chigger bite, and swollen lymph nodes. What are the causes of typhus? Typhus is caused by bacteria spread by insects and other parasites. Murine and epidemic typhus are transmitted when an infected insect bites you and leaves bacteria-laden feces on your skin. If you scratch the itchy bite, you can introduce the infected feces into the bite wound or other cuts on your skin, allowing the bacteria to enter your bloodstream. Scrub typhus is contracted differently. If an infected mite bites you, it can transmit the bacteria directly through the bite, even without scratching. Typhus diagnosis. If your doctor thinks you have typhus, you'll get a blood test to check for typhus bacteria, especially if you've traveled to an area where typhus is common. It can sometimes take weeks to get those blood test results, so the doctor may recommend you start antibiotic treatment right away to be safe. How typhus is treated. The most effective treatment for all 3 types of typhus is the antibiotic doxycycline. A single dose of doxycycline has been shown to be effective against epidemic typhus and works quickly on other strains as well. For the best results, it is crucial to start taking the antibiotic as soon as symptoms appear. If you are allergic to doxycycline, or if it is not effective, doctors may prescribe another antibiotic, such as ciprofloxacin. What are the complications of typhus? If left untreated, typhus can lead to serious and potentially deadly complications. These complications include inflammation of the brain and spinal cord, an enlarged spleen, inflammation of the heart muscle or valves, internal bleeding, kidney damage, liver damage, low blood pressure, pneumonia, and septic shock. Prompt treatment is essential to prevent these severe outcomes. Typhus prevention. A. There is no vaccine to protect against typhus, but you can take several preventive measures. Basic hygiene, such as bathing at least once a week and regularly changing your clothes, is essential. Avoid close contact with wild animals known to carry typhus, such as rats, flying squirrels, and opossums, and keep your yard free of food waste or other trash that might attract them. To protect against murine typhus, use flea control products on your pets and in your yard, and avoid letting your pets sleep in your bed. If you are traveling to areas where murine or scrub typhus is common, use an insect repellent containing 20% to 30% DEET. Is typhus contagious? Typhus is not transmitted from person to person like a cold or the flu. There are 3 different types of typhus, and each type is caused by a different type of bacterium and transmitted by a different type of arthropod.